Now, more than 3,000 health workers have received COVID-19 vaccines in the Western Cape. This as the country implements phase 1 of the vaccine rollout program. To get an update on the progress in the Western Cape, I'm joined now by the Health MEC, Nomafrench Mbombo. MEC, good evening and thank you very much for your time.
Good evening, thank you.
You describe the progress in the Western Cape as smooth but slow. What are the bottlenecks that are, of course, limiting the flow to be a little bit more swifter?
As of now, we have until 5 o'clock, we've vaccinated about 5,394 of the healthcare workers in the 3 sites, which is the Tygerberg hospital site, the Grooteskier hospital site, and also Khayelitsha. And also later today, we have also activated another site, which is the Kalbrima hospital, because our target is just to have about 500 per day for each Tygerberg and also for Grooteskier, and also 100 per day for Khayelitsha. So to have another site is to make sure that we don't have bottlenecks. Because like today I was in Tygerberg hospital site where we had quite a long queue of people coming in. So the bottlenecks was before and also during the weekends, noting that for the weekends, Saturday is for the private health hospitals, and then for Sunday is for the GPs. So at least now we are there and we'll be able actually to meet our target of even vaccinating more than the 500 per day per each, as I alluded to.
So you're sitting at 5,000 now. The target is for 13,000 in 2 weeks. Will you still be able to reach that target?
Oh, of course, of course. By tomorrow night, we'll have actually vaccinated half of that 13,000. And by the time we reach the 2 weeks, we'll have completed all of those 13,000. Actually, it might be when we receive from the next batch of the 18,000, actually our target might increase. We do have the capacity to vaccinate more. We have trained more than 3,000 of the vaccinators, and also we've seen quite a lot of interest even from the public, where like today when I was in Tygerberg, and also it's a weekend when I was in Grooteskier, we had quite a large number of private hospitals, specifically Netcare, Melomed, and all others. With the GPs that we vaccinated over the weekends, they showed actually an enthusiasm and willingness to assist us when there's a need for the vaccinators. I think most of the bottlenecks are because of the availability of the pharmacists who are part of the researchers, because the rollout is part of the clinical trials, open label. It means that the researchers have to make the point that they label and do things accordingly. So we can't even assist them bringing our own pharmacists in regard to the labeling. Noting that for each and every dose that has been withdrawn, there must be a label where it says Nomafrench Mbombo, and the vaccinator must provide that vaccine to Nomafrench Mbombo.
Yeah. And is there a conversation around requesting more of the researchers or more of the pharmacists to be made available?
We have escalated that to the researchers. So that's why we have activated the 4th site, which is the Kalbrima hospital, so that to be able to ensure that we don't end up having much of the bottlenecks that we've seen in the Tygerberg site. Noting the vaccinees, they are not necessarily coming from those hospitals. They have to also cater for the primary healthcare staff coming from the clinics and the EMS, and also some of those coming from the private. So that's why it is crucial for us to see to it that we expand the areas to have many more of those. So yes, we have made a call that we need more of the pharmacists in regard to that space, because we've got as many of the vaccinators that are available.
Now, since the start of the rollout, MEC, have you reported or have experienced in the province any side effects?
Not as far as I'm aware, taking note that each and every person who wants to be vaccinated has to register in the National Electronic Vaccine Program. And then there, it also provides one to access in case one wants to report the adverse outcomes or the side effects that are not expected. But also in addition to that, we do have a responsibility also to create an environment where people could be report such, but noting this phase for the 500,000 doses that now for the whole of South Africa, they are part of the implementation study. So the Sisonke study, which are the researchers, they also have got a responsibility to ensure to report those. But at this stage, with the 5,394 that we've already vaccinated, not a single one has reported any abnormal adverse effects as such, as up to now.
MEC, we appreciate your time and thank you very much for joining us tonight. That's the Western Cape Health MEC, Nomafrench Mbombo.